Hi, I'm Mitra. I'm one of the GPs at LloydsPharmacy Online Doctor. Today I'm going to show you how to properly inject the Mounjaro pen. So you take Mounjaro once a week. So first of all, you've got to choose which day of the week you want to take it. And you can take it at any time that day. However, if you choose to change the day, then you must leave 3 days in between doses. So before you inject Mounjaro, make sure you wash your hands. You'll also want to check your pen. You'll need to check the expiry date, the dose, and also the colour of the liquid. The liquid should be clear to slightly yellow. Don't use your Mounjaro pen if it's been frozen, discoloured, cloudy, or has particles in it. And never use a pen that doesn't match your name or prescription. To begin with, remove the grey base cap, which should come off easily. Then sterilise the red inner seal with an alcohol swab. Always use a new needle for each injection. Pull off the paper tab, push the capped needle straight onto the pen, then twist the pen needle until it's tight. Now you can pull off the outer needle cap, keeping it to one side. Next, pull off and discard the inner needle cap. Next, we'll prime the pen. Slowly turn the dose knob. You'll hear 2 clicks and the extended line will be shown in the dose window. Hold your pen with the needle upwards and tap the cartridge holder gently. Then release some medication into the air by pushing the dose knob until it stops. Then you need to check that 0 is appearing in the dose window. Mounjaro should be injected into either your stomach, thigh, or the back of your upper arm. If you use the back of your upper arm, you might need someone to help you. Clean the injection site with an alcohol wipe. You can inject in the same area each week. Just make sure it's not the same spot each time. Now you're ready to inject. Turn the dose knob until it stops and the number 1 is seen in the dose window. This is equal to a full 0.6 milliliter dose. Place the clear base firmly on your skin. Inject the medicine by pushing the dose knob until it stops, then slowly count to 5 while holding down the dose knob. The 0 icon must be shown in the dose window before removing the needle. Your dose was properly administered if the grey plunger at the top of the pen is visible. Your pen contains 4 doses. Once you've completed the 4th dose, please throw your pen away in the sharp bin provided. If you have any questions about this process or want to find out more, visit our website.